I'm an adult child of an alcoholic. In my family, grew up Irish Catholic, and we drank to celebrate, to mourn, to have stress, to anything. It was a reason to go to the fridge. With that being in my history, I was drawn to addiction work. 1 in 10 people who need treatment get it, right? And I've long been just obsessed with the question, how do we reach the other 9? I looked at the whole concept of our treatment teams and became enamored with the idea of, if anyone could really see these folks from the inside out and what they do on a day-to-day basis and how committed they are to the work, then coming through those gates might not be so scary. My first 10 years of my professional journey were spent at Chrysler Corporation in Detroit, and I am an HR person by training, and I was part of a high-potential HR development program and really gravitated toward compensation. And so spent a number of years doing all sorts of different compensation and also employee relations. And I became fascinated with just the notion that people would blow up their lives. They would have these wonderful careers and glorious compensation and all the benefits that went back with automotive in those days. And they would blow it all up with some sort of behavior and what I know now to be a maladaptive coping mechanism. And so I have a master's in labor relations, and everyone would always tease me because I would be so interested in the why. And when we would design compensation systems, I would be, let's do this, let's do that, let's move this behavior, let's do this. And so the why was always so intriguing to me. And so when I had the opportunity to go back to school, I got my master's in professional counseling in Arizona, and then got licensed very quickly as could be. And I'm an adult child of an alcoholic. In my family, grew up Irish Catholic, and we drank to celebrate, to mourn, to have stress, to anything. It was a reason to go to the fridge. And so with that being in my history, I was drawn to addiction work. And that was 2003, 2004, which was a really interesting time in our industry. And so I went to work after doing my work in community mental health. I went to work at Journey Healing Centers, which was in Scottsdale and Salt Lake City. And I spent years there doing every job that can be done in a residential treatment center, and then went into leadership. It was interesting when someone finds out, oh my gosh, here's a clinician who loves spreadsheets and likes to talk in numbers and is actually not afraid of the business part or doesn't dislike the business part. It became clear that I was going to be a clinical director. I think I was a clinical director before I was independently licensed, which looking back on that was not the best. But and so had that role for a number of years and left when they sold to Elements, and then was recruited to go to Sierra Tucson to be the chief clinical officer. And so that was a very long-winded answer to how I got into behavioral health, and that role at Sierra Tucson and the years before it, working in residential treatment, really got me, I believe, that solid foundation to where I am now.
You know, if you don't mind, I'm gonna ask a question that you did a pretty hard pivot from HR into this. I'm curious. Had you explored that adult children of alcoholic, the ACOA aspect, while you were this hard-charging HR corporate person, or was this something that came later as you shifted into this work? I'm just wondering which informed which, or was it either?
I was probably too busy drinking to actually explore it.
Got it.
So no, I didn't. And the culture in the automotive industry is very alcohol intensive.
Right.
And so the thought didn't even occur to me. It was all about, everybody else and how they were functioning in their world. So, no, I wasn't even aware of that ACOA is a thing.
Got it. Okay. So then it's really interesting that self-sabotage aspect that really intrigued you. I mean, it's like pretty fascinating. That's pretty fascinating how that opened up a whole new journey for you. That's really super cool.
Yeah.
Well, and in hearing that part of your story too, Jamie, it reminds me of Kelly Skaggs, who I know you're friends with, but being a chief clinical officer and then getting, okay, we need you to step into the CEO role. And of course, I just ran into Krista Gilbert, very similar. She was a chief clinical officer before she stepped in. So do you find that's super, like you made a comment about what came first. I mean, you find that that's super important for you in your path to have that chief clinical officer background before you step into running a treatment center?
100%. And it was an interesting journey because the chief clinical officer role, I loved it, and I was getting my doctor of behavioral health, and I really wasn't interested in what I jokingly refer to going to the dark side. And then I had the opportunity, and I was really inspired to do it, and I prayed on it and really spent a lot of time thinking what it could mean to our industry, because they had not, Acadia at that point didn't have women running flagships. And I thought, okay, I mean, I'm inspired to do this now. And I absolutely love the team at Sierra. So it was a very natural yes. And it still is. I draw on that experience so frequently. And I'm just so grateful that I can do that.
Yeah. Well, Jamie, I mean, you not only did the HR, but you also did the labor relations in a very grizzled industry of some hard chargers. And I guess, how do you feel like that set you up for leadership with even the Meadows today? Like, how does that transpire into what you're doing?
I have a great deal of grit, and working residential in all the years that I have, I mean, one cannot shy away from things. And there have been some very heartbreaking situations that I've been involved in, and we know anyone who does this work long enough, we have them. And what I've been able to do is to draw on that experience as a leader, to be centered, grounded, and to lead with compassion, but no fear.
I'll tell you what, Mark and Jeff, I am so glad when I was at the Meadows that Jamie wasn't there yet handling my compensation negotiation. I can tell you that.
I think you are lucky, yes.
Well, I was wondering, on the compensation side, whose side were you on, the employee side or the company side in terms of who are you trying to get the best outcome for?
That's a great question. I would say somewhere in the middle.
Oh, okay.
And with executive compensation, we all know that's a dance. And so doing what's reasonable. And we were very analytical and did a lot of salary surveys, did a lot of work with the Hay Group. And so I really had a lot of data upon which to build my decisions. So I didn't have as much autonomy as one might think.
Wow. Jamie, let's talk a little bit about the Rehab Playbook.
Let's do it.
Why did you feel the need to write this book for the industry, which I read it over the weekend, amazing book. I truly think that everybody coming into this field should be required to read it. It just breaks it down so easily and simply to understand everything that a family would go through, everything that a patient would go through, just anything anybody working in a treatment facility would go through. So love to just hear what sparked this.
So we all know that 1 in 10 people who need treatment get it, right? And I've long been just obsessed with the question, how do we reach the other 9? And so it was in COVID, I was working at Sierra Tucson, and I was humbled and in awe of my coworkers who showed up every day, and we were all essential workers, right? And even in the beginning, there was no PPE. We had the receptionists sewing our face masks, but we wanted to keep the doors open to continue to treat the people that deserve treatment. And so I looked at the whole concept of our treatment teams and became enamored with the idea of, if anyone could really see these folks from the inside out and what they do on a day-to-day basis and how committed they are to the work, then coming through those gates might not be so scary. So I decided to tell the story, and I began interviewing people in each role of the treatment team. And I asked my colleagues across the country, who do you think the best primary therapist is you've ever worked with? Who's the best DON? Those kinds of questions, because I didn't want it to be all based on just people I knew. And so I did 45 interviews over a year and a half, and wrote the very detailed description of their roles and what they did and what someone should be looking for in a treatment program concerning this individual and their daily duties. And so I put it all together in a beautiful book called The Treatment Team, also talking about integrated care and why it's important, and the research tells us that's the only way to approach a co-occurring disorder. So all ready to go to print. I showed it to a dear friend of mine, Nick Carderas, who's a best-selling author, and he said, let me introduce you to my agent. And I was like, haha, okay. And he read my book, and he said, you know a lot about this. I put my child in treatment last week. I need a book like this. However, I don't want to hear about all your friends. I want, you know a lot, put it down.
Yeah.
And if you will do a book proposal with everything that you know, I'll shop it. He did, and we got represented by Regalo Press. And so then I wrote the book. And it was a lot of things survived from the original work. The interviews, 40 aren't in there, but 3 survived. And also my stories of the things that I have loved about the work over the past 20 years. And then for fans and family. You know, we know this is a family disease. And I wanted the book to be able to support not only people considering their own care, but if you love someone or your coworker, regardless, I wanted it to be able to touch them too. So,
well, I told you, Jamie, in the car that I think that your Meadows admissions team needs to be sending this book out, because I think that especially for families, and going back to our foundation's days, we know that half the phone calls are coming from the family members or loved ones, and so that's where you can really make. I think some inroads, and this book will open up that. But I loved it was in one of your early chapters where you're talking about little wins, and that is something I had not thought about. And when the example you were giving about the Super Bowl party or some sports party, and the gentleman just agreed to maybe only have 2 beers, and that was a huge success because it built some confidence that he could do it. And it's those kind of specific stories that I think will help families realize that, okay, yeah, they're heading toward this bottom, but see that as a good sign.
Yes.
Whereas a lot of times we just say, well, why can't you just stop?
Right. Yeah. And I'm a big fan of hope. And that was the other reason I wanted to give people hope, because there's so many negative things out there in our industry. And, rightfully so, we've had some bad actors through the years.
Right.
But there's more miracles and more magic than the bad actors. And it was so important to me that we get that message out, and especially with new books coming out all the time, Rehab and American Scandal and all these things that when people read them, they will say, oh, see, I'm not going to treatment.
Right.
And I wanted to find a way to instill hope. Because people get better. I can show you texts from people I worked with, when I was a therapist 15, 20 years ago. Just celebrated my 20th anniversary, my anniversary of sobriety, and I'm still there. So thank you. People get better every day.
Yeah, you said 1 in 10 actually go get the treatment they need. Out of the other 9, what do they get completely wrong about this until they experience it?
I don't know that they're getting anything wrong. I think they're scared. And fear has so many different faces. And when you think about what's involved in picking up the phone, talking to a stranger, and then putting it doesn't matter which level of care, you think about that vulnerability. To really tell your story to someone that you've never met, you don't know what they're going to do with that information, putting your life on hold, all of it. And let's just think for a minute that most folks of the 9 have some sort of trauma, right? And they're using in order to cover up those symptoms of trauma. The thought of taking that away, oh my gosh, it's terrifying. So I think that's why.
Yeah.
Yeah, I think it was. I'm Jeff. I may be, inaccurately quoting, but I think Jeff, you're one of the first that I heard talk about in training admissions people about how heavy that phone is.
Yeah.
And like we have to recognize that sometimes we get a little frustrated, that they don't come in that first phone call, but that phone is so heavy.
Yeah, I mean, it weighs 100 pounds. When somebody is making that call, it's like, I mean, it is burdened by all of the things that are in their life, and it's like sometimes it takes a forcing function, sometimes it takes a spouse, sometimes it takes trouble with the law, sometimes it takes an employment situation that finally gets people to do that. But even then, that phone weighs 100 pounds. I mean, it is so hard to pick up that phone and ask for help.
And Mark, you were saying early on before we went live, you were referencing a quote about we have to love them until they can love themselves. Yeah. I think from your book, I think that's something that sometimes families that might be listening to something like this, or people working in admissions and marketing, they need to always reflect on that.
Yeah, you that really hit me over the weekend. Just you have to love them until they end up loving themselves. And I'd just be interested in, like, I only imagine that shows up in your leadership, and maybe if you talk a little bit about that, like where that came from.
So I'm a big fan and advocate of trauma-informed leadership. I believe in it, trauma-informed organizations, trauma-informed care. And so if I am truly practicing trauma-informed leadership, then I have an awareness of not just what's right in front of me with a team member, but all those emotions rumbling underneath.
Right.
Like, what are they carrying in with them? Someone may be having financial problems. Someone may have just lost a parent. All of it, we know the things that everyone goes through. So to have that awareness and to be able to connect on that level, to say, I care, I support you, and I am aware that you may be emotionally dysregulated, and we all have trauma. Just that acknowledgement provides all of us with humanity. And having an organization that embraces that really, it facilitates dignity in all of our communications. And, we can tell people, I have let people go from a position that they love, and I dare say that they still feel dignity when they leave the table. And I think that's really important in trauma-informed leadership.
Boy, what a gift to be able to give somebody bad news and they thank you for it. What a gift that must be, and what a gift that must be for the people that have the pleasure of working directly with you. That's a lot of giving. What do you do to make sure that you are filled up? Like, how do you surround yourself so that you receive that same sort of feedback as well as giving it to those that that report to you?
Well, first and foremost, I have horses, and I adore my horses.
Nice.
And I've recently gone back to competing. And so that's something that I do that I completely forget about everyone. And so that's something that I do to fill my cup. And that's something, horses are grounding. And they also, they're a mirror for
they're so empathetic.
Yeah.
Absolutely.
And so I do that for myself. And then also, I've got a very solid and close family. I've been married for 35 years. And so my family's always been very supportive of my work and the journey. So I'm able to, better than I was maybe 5 years ago, I can shut it off now and attend to my children, grandchildren, and spouse in a way I wasn't able to.
Do you have some favorite trail rides in Arizona that you want to share with us?
I don't trail ride.
Oh, you don't trail ride?
No.
So how do you get the experience?
No, she's
with the
down in
horses?
Ocala at the World Equestrian Center, Jeff.
Oh, okay.
I compete and I do Western dressage. So
Okay. All right. Well, God, I'm glad to clarify that. So forgive me. That's fantastic.
yeah, it really takes a lot away. You can't stress about work or worry about your phone when you're on a 1,200-pound animal.
Oh,
Yeah.
Absolutely.
Well, you do the horses, and Lee and I, we get the honey-do list. That's how we actually have to decompress, and it's usually picking up sticks or leaves or things like that. So
I finally got all the sticks and limbs because we had a major ice storm here, back in February, and I finally have gotten my yard where it looks somewhat back to normal now. Mm-hmm. That was my workout. I'm not in the gym. I'm just go out and pick up logs.
Yeah. And I was gonna say, you just as the chair of NATAP, you get the macro view of, the whole industry, being surrounded by so many leaders. Like, where do you see treatment programs falling short today?
Where I see treatment programs falling short, and I would include the ones that I oversee, is too many demands and too few resources. And I just spoke about this on my panel at the AI conference, is that right now we're experiencing a great deal of provider turnover, specifically with clinicians.
Yes.
And it's not as attractive anymore for newer clinicians to work in behavioral health, and specifically to work in treatment, I should say. And what happens is that we end up with a lot of inexperienced and non-independently licensed clinicians. That's a problem across the board, whether we're treating mental health, SUD, or co-occurring. And so that's where I think we're all falling short. How do we attract and retain people to love the work in a way that a lot of us that have been doing it for some time love it?
Yeah.
And acuity levels continue to be on the rise, in my opinion. Would you agree with that?
100%.
Yeah.
And so having the expertise in order to really work effectively, I mean, we do a great job, and we have great clinical leadership that helps oversee and supervise. But if we could train more folks and hang on to them, I believe that would be a game changer. The other thing is in terms of payer contracts. The payers have been talking for 10 years about value-based agreements. And we have one.
Well, so here's the joke that I've thrown out numerous times about value-based care. It's like the lotus flower. It's just like it's going to be beautiful someday.
Right.
I mean, it's like, when will it bloom?
Yeah.
I mean, Jamie, are you optimistic that we'll see more value-based care? I mean, I'm thrilled that you have one contract that's actually value-based.
Yeah.
That's amazing. Do you think that's going to be an area of expansion, or?
I have to be optimistic and say yes, because what's ending up happening now is that we have expanded access to care. We have people walking into the door of the Meadows that would not have been able to do so 5 years ago. And that's so important to all of us who've been committed to this expanding access to care. And they're getting good care, their outcomes are positive. And so were I a payer, I would say, something's working here. And my folks deserve this. And so I'm going to seek more. I'm going to get more people enrolled in it. And I'm not going to try and do it for a ridiculously low rate.
So did the Meadows seek that contract, or did the payer seek that arrangement?
So that was before I joined the Meadows, but my understanding is that we fought hard to get that. And I was also leading a charge with another Arizona program where I was the EO. And so I know that we were both simultaneously seeking it and both got contracts the same month of last year, which is fantastic.
So how old is that contract now?
January 2025.
Oh, wow. Okay. Having now had a year, do you feel like would you do anything differently now? It's like, I mean, these are so new, and not everybody completely understands the parameters associated with it. It's like, I know it's only a year in, but it's like, what advice would you give people that are thinking about these things?
So if someone is making the shift from a self-pay environment to a managed care environment, I would say that you can't do enough upfront planning for documentation and education on the different patient profile, and also the different treatment goals of someone coming in. The whole motivation for care looks different. And being able to give someone an effective treatment episode when you might not get a full 45 days. Most often you won't.
Right.
And so, I mean, those are a number of the variables, but what I would do up front a bit differently is really educate more thoroughly in terms of the documentation expectations. And we did a lot for our preparedness, but I don't think there is too much.
Got it. Well, I mean, let's just go straight into that door that you've opened. I mean, so the Meadows is going through, or has made this transformation to a managed care approach, right? So, I mean, that's a big turning of a cruise ship, basically.
It is.
Right.
And our outpatient programs have always been in network, and our Texas program, the Meadows Texas, is in network with most payers. But when we in Wickenburg have been in network with TRICARE and TriWest. And so there is that familiarity with our active duty military and VA. So that was a godsend that we had that foundation. But to have a large national Blue Cross Blue Shield contract, that has been a game changer. And so there have been so many areas of our program that have been touched by this shift. But something that's really beautiful that we've seen is in our Gentle Path program. We are seeing, and that's our men's sex addiction program, and we are seeing just really long length of stay there. And everyone's saying, oh, well, you know, sex addiction, you can't get an authorization for sex addiction. True. But if you look at the co-occurring nature of those folks and the number of presenting diagnoses that they have, that we're just thrilled that Blue Cross Blue Shield is acknowledging that, and that we're able to demonstrate the need for care for an extended time period. So that's been a real learning as well.
Boy, that speaks volumes to documentation. That speaks volumes to utilization. I mean, you're doing a tremendous job in order to make that happen.
We have a very strong UR team, and we have a chief medical officer, Aaron Wilson, who came from a managed care environment, and he's done a wonderful job training the medical providers and really getting them to buy in as well.
I was going to ask, especially when you mentioned Gentle Path, how much of the success do you think is somewhat related to having like Patrick Carnes and Stephanie Carnes and Claudia Black? Because when you think about, you know, when I was there, I mean, you've got the best people training and mentoring your staff, and I would think that a lot of people would want to come to the Meadows just to work there, and I would think that the payers would be impressed that this is not just some program that you guys just went to ChatGPT and built. No, this is the legacy of the Carnes family.
And that plays a very important role. And, you know, the interesting thing is Dr. Carnes, he is 81 now, and he spends his winter with us in Wickenburg, and he does 2-hour lectures every week. And he's always on campus, and the man is pure magic. He walks in the building, and he is still the larger-than-life individual that he's always been, and the patients adore him. And he does the same for staff, and the same with Stephanie Carnes. I mean, she is very, very involved with training our staff, and she does weekly lectures for our programs as well. And Claudia, I can't say enough about Claudia. She is hands-on. She's always at the Claudia Black Center, and if there's a particularly difficult family, Claudia's in there. You know, if someone needs help with the timeline, she's in there. And she spends a lot of time out in the field with us too, doing counselor education and training, which we really value as well.
Well, while we're dropping names, just catch me up. You still have Dr. Kevin McCauley?
Oh, yes. He's another one that's always out and about.
So we can do the shout out to the Meadows fellows here.
And Tion Dayton?
Yes.
Yeah.
Just was in town last week.
And who was the eating disorder?
Jenny Schaefer.
Jenny Schaefer. She's
Yes.
still excellent. I mean, that was.
Hold on. Let me just see if I can tick them off. So Bessel Vanderkolk?
Yes.
Still?
Yes.
Schwartz, Dr. Schwartz.
They're a little harder to get to. You won't see them on campus, just in
Sure.
full disclosure.
Sure.
Yeah.
Well, I'm and sorry if I've left anybody off of the Meadows list. I mean, it's just kind of like a little, you know, little bit of a little trivia quiz there. I'm curious. So, like with the Meadows Fellows, for example, and then now we're shifting to a managed care model. Is there cognitive dissonance with that level of clinician and then the managed care delivery, or is there an understanding that this is the way business is done these days? Or I'm curious about like what is it like in that room talking to them about these are the things that the payers want.
Peter Levine is the only one that we left out.
Okay,
Yes.
thank you. Thank you.
He's very involved with our compassion fatigue initiative, by the way. He does supervisions monthly with our team if they're experiencing compassion fatigue. So he's all in. I don't see it as cognitive dissonance because, to be honest, our senior fellows, like, they don't think much about documentation. We have preserved the Meadows model. And Pia Melody, God rest her soul, you know, that was her life's work and legacy.
Right.
And you will find that in each one of our programs. We have modified it a bit to include in one of our pillars of care innovative psychiatry, which we think is so important. But that Meadows model of childhood trauma, I mean, that lives, and it lives across all of our campuses. In terms of the fellows, they are very hands-on with training our staff. And so to me, they believe, the ones that I've had this discussion with, they believe in expanded access to care, and they love that their life's work is touching more people. And so I have found nothing but support from all of them in this. There was a bit of concern about not having people in residential for 45 days. Mm-hmm. And that's something that we've really been able to manage across the board. We're not getting 45 days of residential with, for every patient. It would be, dishonest for me to create the impression that we are. But what we are able to do is to deliver an episode of care that fulfills the promise of the Meadows model. And then we have stepped down into our PHP and our IOP where we can continue the work.
I feel like it. When I went to the Meadows in 2019, that was when Meadows, Texas, was just getting ramped up, and there was that push and pull because it was like, well, we're a 30-day program, we're not. So I feel like over those years, it's probably helped kind of lead into what you're doing now in Wickenburg because you kind of had Meadows, Texas, as kind of a test tube, so to speak.
Absolutely. And, we have the Meadows Malibu, which is still a self-pay program, and that's 30 days. Mm-hmm, mm-hmm. And so we have seen and we've been able to convince folks that, yes, you can get a good episode of care with less than 45 days.
Yeah.
And I believe that in my heart.
Well, if anybody hasn't been to the Texas property, it's in Princeton, just north of Dallas. I mean, it's such a beautiful – I forgot who we bought it from.
It was Karen.
Was it Karen?
It was Karen. It was Karen, Texas.
A wonderful property up there.
It's lovely.
Yeah, yeah.
Jamie,
Not that Wickenburg's not wonderful too, but yeah.
It is.
I'm interested in just even taking it back just a step, just hearing your upbringing, hearing like how you quickly grew in your early career up the big corporate ladders that you did. It just tells me you don't back down from a challenge, and you take on anything that's in front of you, but. Mm-hmm. Like, what attracted you to take on the Meadows role? I can only imagine, being a new president in any organization's tough, but then one at the scale at which the Meadows is, you didn't back down from that challenge. What was it that attracted you to this opportunity?
So I've lived in Arizona for many years, raised our family here. I'm licensed here. I practice here. And when all the years I spent at Sierra Tucson, the Meadows, we became really good friends and collaborative. And the former Meadows CEO was a good friend of mine. And when it came time for him to move on, he always used to tease me, "You belong at the Meadows. You belong at the Meadows." And
and not as a patient, but as a leader.
I don't know what he meant. Probably a little of both, to be honest with you. And so it was not a new idea that I would come to work for the Meadows. And so he thought that it was a fit and that the time was right in terms of where the Meadows was going and the skill set that I brought. And so, again, I've always admired the Meadows so much. And being an Arizonan, I really love to be back and, part of a Phoenix community and to really be able to take Meadows to the next level.
Yeah. Well, I know in the space, I mean, you're not only like leading the organization, but I know you also have a big focus on bringing up other women in
Yes.
this industry. And I know you're very passionate about it. I know you, Kelly Skaggs, there's a whole lot of really impressive like females in this industry that are trying to get more to rise up. What I mean, maybe we can talk a little bit about that, but also I'd be interested in hearing, was there a mentor that you had in the past that like maybe put you on that journey of how can I help others?
So I've had so many wonderful mentors in our industry, and quite frankly, most of them were men, because
Okay.
there weren't a lot of women in the high-ranking leadership roles, and especially not any that were interested in helping other women get there. Krista Gilbert is one that she was an inspiration to me when she was CEO at Constellation. She was extremely kind to me, and whenever I would see her, be like, oh my gosh, she's doing it. It can be done. A woman can run a behavioral health platform for a private equity company. And not only had she made it, but she always reached out her hand to bring someone else along. And so she was an inspiration to me in that. And, I love that Madeleine Albright, there's a special place in hell for women that don't help other women. And so, I have been extremely intentional about not just the women, about others that want to learn more, that want to grow, of bringing them along with me.
Yeah. Well, you're in all the rooms where a lot of big decisions get made, and with NATAP and others that you're involved with. But like, what are you the most excited about of what's coming up?
Two things. I am really excited to see what ends up happening with AI. I believe that it can be incredibly transformational for patient care, and also for our clinicians and our providers and everyone right now that is feeling completely burnt out and with the compassion fatigue. I've been a compassion fatigue advocate for more than 10 years now, and I believe I'm the most excited about the quality of life for those of us that love this work and want to live long enough to continue doing it. And so that would be the main thing, I would say. And then something else is that I'm really excited about the next generation of leaders coming up. And I always joke with, the folks that I mentor, like, you will be my guarantee that I can go ride horses all day someday. And, and I'll make a joke like, well, when I'm in assisted living and you're doing this, I'm really excited about the next generation. And not only that they're more representative of our patients, because no offense to any white males that are in recovery, but that is not representative of all of our patients. And so when our leadership looks more like our patients, feels more like our patients, then that's going to help with the other 9.
I love that you're approaching leadership from sort of a planned obsolescence approach. I mean, it's like, giving space for people to grow into that, but then also, give them the needed burden to say that this is not something I'm giving you. This is something that you're earning, and this is something that you're going to grow into. I just think that's fantastic.
It's a labor of love. Again, it's like writing the book. It's something that I am extremely committed to, because we've got to leave this ship that we talk about metaphorically, turning this cruise ship. We've got to leave it in the right hands.
Yeah. I listened to a podcast this morning on AI, and they talked about, just the reluctance of people to embrace AI. And I don't know how it is at the Meadows, but, they actually talked a lot about, in order to get this down in the organization, it has to come from the top. And I know you're in town for an AI conference, and it seems like you're all into it. And I agree with you 100% on, just it's simplifying people's lives and jobs to where they can provide better care. What, how do you drive it down in the Meadows? Like, how do you make sure that everybody understands that it's important to you?
So the first thing that we've done is we have a governance team. And so we obviously have our policy, And that was in late 2025. No one lives to scan the new policy that's coming out.
What?
So we're making it practical. And our governance team, we're calling it the AI Care team. And so we are involved in every decision, and we are communicating what our plans are, and also our mission, that our mission is to provide humane care, improving quality of life for everyone, and we are not looking to replace anyone. And the other piece is that I use the word compassion a lot. We're going to do an intentional, responsible, compassionate implementation of AI.
Yeah, it's very important.
The other piece that I've done is I've really started to do a lot of counselor education and training on the ethics of AI. And it's really interesting. I've got a 3-hour CEU event, and it also includes digital ethics. And so everything that we deal with as licensed clinicians on, I say Facebook, everyone's like, you're so old. I mean, it's TikTok and Instagram and what all of that means to our practice. And then that naturally morphs into talking about AI and clinical practice. And I have found that in all of our major markets, literally 120 clinicians will come to talk about this. And so I've firmly planted myself in ethics and understanding that, and to be able to talk about it. And that really builds trust, I believe, on an enterprise level, that people know that that's where I sit on AI. That's my expertise, building expertise. I don't want to call myself an expert yet. And so this isn't just, they're doing this so they can put 3 more people on my panel or my caseload.
Let's go back to the beginning. Well, not the beginning, but sort of earlier in the conversation, where you mentioned one of our biggest challenges is attracting people to work in the treatment industry in this. So I'm curious, how do you think AI can actually help us solve that issue, or do you think it does?
I think it will, and it will do that because it's changing the narrative about what it means to work in residential treatment. Because right now, our primary therapist, which, by the way, I think being a primary therapist in a residential program is like the greatest gift one can ever get. But right now, they'll tell you they're doing documentation till 9 and 10 at night.
Documentation. Okay.
Documentation, and risk.
Yeah.
Because they're looking at, that's the whole thing about compassion fatigue. When one is exhausted, one will not do their best documentation. They may cut a corner here or there. And so empowering the clinicians to do the work they love and to give them a reasonable tool to do their documentation, it's my hope and prayer that changes what it's like to be a therapist again.
Yeah, the irony of having to bring all of that empathy and all of your skills into the session, and then ultimately what gets reflected, that empathy and skill needs to be reflected in their notes. Mm-hmm. And of course, they're going to document at a time. They're not going to have the same amount of empathy when they're actually documenting that. So I mean, I think that's an excellent point.
Mark has introduced in calls with some of my clients that utilize Snapshot this AI assistant that basically after the meeting, and it might be a 20 or 30 minute meeting, but it just summarizes, and it's done a good job making sure that, because we take notes, but we can't take as good of notes, and it's nice that it catches, like somebody will be like, okay, well, Lee was going to do this, or somebody's going to fall, and it's just,
I love that.
It's nice to have that. And so do you see, and again, this may not even just be specific for the Meadows, but from a NATAP perspective, do you see more treatment centers adopting an AI assistant to be there just listening to that session to make sure everything is documented? Because I know some centers are already working ahead and some are like not sure.
Mm-hmm. Absolutely. And that's where I see people they're actually using the ambient listening and using it for their documentation. And so are the payers, by the way. The payers are using it to synthesize our notes to see what's being done by AI. Interestingly enough, though, the folks that I know that have implemented an AI tool for documentation, the most important thing, though, is that it's reviewed by a human.
Right, right.
And so, because there at the conference just now, there were some really scary stories told about notes that had, either the wrong pronouns or they left a sentence in from somebody else's note, those kinds of things.
Yeah.
And so to get that human involvement where we're going to review, sign off on it. And as we are telling our therapists, when we're talking about this, we are piloting a documentation tool right now, but it's still your license. They're not going to, if you blow it, if something happens, they're not going to go after your chatbot. That's still you.
Right.
I feel like, there's been a lot of controversy, I think, around this. But, we were testing Dragon Speak,
Right.
15, 20 years ago. And it was obviously it was not AI. It didn't
Right.
have the computing power, but it was basically listening to what you were saying and just translating as best it could. Do you believe that there'll be an AI assistant on inbound phone calls? Can you imagine, like on an admissions person, that they would have an AI assistant?
I think there's a vendor or two.
Oh, no, there are. Yeah, for sure.
They're
Yeah.
doing that right now.
Yeah.
Yeah.
I think there's a few centers that are testing. I think I could see a lot of value, but it's going to be interesting to kind of see how that gets trained.
Yeah, absolutely. And for your AI bot to be trained to know, like, what's a risk factor for suicide? What's a warning sign? When do you call 911? I mean, that's something our admissions people are trained to do. When do you do a wellness check? And
Yeah.
so those are the concerning factors that we need more time on.
It's moving so scary fast.
Yeah.
Just talking about like compliance and ethics and all of that. I mean, you can just put this in the book. Within 12 months, there'll be an AI agent that is your compliance officer and your ethics officer, and they won't allow anybody to do anything with AI if they make a misstep in one of those prompts. It's going to be, probably an agentic agent that then reports back to whoever you on, hey, this happened and it wasn't a big deal, or this is happening consistently and it's a big deal for the organization. I mean, that will happen.
I believe within 12 months. I think you're right.
Yeah. Well, what in the next, what would success look like in this industry in the next 5 years, in your eyes?
So to me, success would be expanded access to care, that we are able to reach more people who are struggling, that we are able to provide quality care for the daily rates that we're paid. And, it's so in this role, we have managed care, self-pay. And in my prior role with Recovery Ways, we were all in network, but we had a number of programs that were Medicaid. And so to be able to deliver quality care for a Medicaid rate and to be able to keep that individual in our care and to be able to provide them with the case management that they deserve in order to keep coming back every day, that to me would be, that's where we need to go as an organization. Now, is that medication-assisted treatment? Probably. There are a number of things that are important components of this, but it is all rooted in expanding access to quality care and to be sure that as providers, that the rates are sufficient to give us measurement-based, quality, evidence-based care.
Yeah.
It's basically reaching the 9 out of the 10. It's like, a win for all of us is that instead of the one that gets the care, it's like continually expanding into that 9. Do you think that 10 number is going to get larger based upon the way society is going, or do you think that's going to be a consistent variable?
I think it's going to change, and what I understand, and again, I have the privilege of working with the Carneses, but what we're seeing in terms of porn addiction and screen addiction across the board is that number of folks that will need treatment, and because these addictions rarely travel alone, right?
They are not solo travelers.
No. If someone has a porn addiction, if someone has a gaming or screen addiction, odds are there's something else amiss. Either a mood disorder, trauma, and, probably half the time a substance. And so those are the folks that, as their lives spiral, we are going to see it expand.
Yeah, I don't have the data today to kind of back this up, but I was curious, and you validated it. with isolation, with the way technology is sort of putting people in silos and unhealthy attachments and even unhealthy relationships with bots and things like that. It just seems like that 10 is going to grow. It seems that way. So all the more reason that access to care, just validating your point, is like I think it's going to be a bigger segment of the population.
I couldn't agree more. And also measurement-based care.
Yes.
It's so interesting in the evidence-based care delivery models to be sure that those are widely distributed throughout all types of populations and all demographics. Because right now with measurement-based care, I have a healthy fear that those are limited to organizations who can afford it. Now at NATAP, we've got the FORCE initiative where we are collecting nationwide treatment outcome data, and that will be available. And we have more than 70 centers that are participating in that right now. So we're really broadening our reach with who can have access to all of this wonderful data so that we can assess what we're doing right, what we can improve on, and then take it to the payers. And let's match it with their claims data and see how are we all really doing.
We're just going to get our AI agent to meet up with their AI agent.
Good luck.
And then establish the value-based care that we've all been looking for.
Well, in 12 months, let's reconstitute and have each of our AI assistants talk to everybody.
Yeah.
That's it.
Or so Jamie, do you want to make any predictions so when we do meet in 12 months, do you want to make any predictions and we'll see how it lands?
I believe that within 12 months, we are going to have more utilization of AI. We are going to have more folks involved in measurement-based care, and we're going to see the payers being more willing and open to have these conversations and to share their data with us.
Boy, I hope you're right. That last one, I sure hope you're right. And it's like, that would be amazing.
But I feel like that's where having our data is so important. We have to show ours first, right?
Well, and I mean, Mark, I know we're trying to wrap up, but I just want to stay on this for just 1 second. I think, for those of us who live in this industry, and this is what we think about all the time, I think we have to constantly remind ourselves that payers, we are just one tiny segment, sliver, of what the payers are focused on. And we're an incredibly important part of it. But it's like, I just wonder, I mean, for example, like, do orthopedic surgeons have better access to data than we do? Or is it kind of the same in every segment? And it's like, are somehow we're more in the dark than others? I don't know the answer to that. I'm curious if maybe you have a take on that.
I think that we have less because we're newer. When you think about really how long has our industry been in existence, it's not nearly as long as orthopedic surgery or any other specialty or primary care. And so we're newer to the game. And I think that as we prove ourselves and we show up as data-driven folks, I think that we're going to see that shift.
We do have a little chip on our shoulder, though.
We do.
We do. Our industry has a little chip on its shoulder, kind of like, somehow we're being left out. We're not in the conversations because of maybe who we are. We're not as respected of an industry as some other healthcare organizations. I don't see it that way, but I wonder if that's part of the conversation as well.
I think so. I mean, there is still stigma, and people believe in it. People believe there's stigma, whether or not there is. That's, they bring it to the table, right? But I also think that there's a subset of our industry that really doesn't believe it's a disease. And they don't really want to talk about the, pesky co-occurring disorders. It's an allergy. I don't know if you knew that. But so there's that as well.
Got it.
I see it shifting.
No, I see it shifting too. But yeah, you're right. You're right. These things take a while.
They do.
Jamie, we're honored that you were on the
Thank
show
you.
today. It was so great that you
I
were
knew
able
you'd finally
to
wrap it up, Mark.
share. Before Jeff asked 5 more questions, I want to make sure that we can be respectful of your time, too.
I would talk about this stuff.
No, thank you so
For
much for being on the
hours.
show. Was there anything, though, that maybe we didn't ask you that you want to share?
think so. I
You
think we
covered
hit
a
all
lot.
the
Well, and
hot
we're going to get you back
topics.
here for Creative Assembly
Oh, I
and
can't
get you
wait.
back to Nashville for maybe the National Markers. I'm very excited.
Was this your
about
first
that.
trip to Nashville?
No.
Okay,
I used to
okay.
come
I was
for
like,
Acadia.
okay, thank you. I was like, sure.
But it's her first trip where she got to actually hang out with some real Nashvillians.
Okay, there we go.
That's the difference.
True Nashville.
Yes.
That's right. I've always wanted to visit Cumberland Heights too. I've got to talk to Jay about
You should,
that.
you should definitely do
The
that.
next time you're out, we'd love to
We can take you
out
around
there.
for
That'd
sure.
be great.
Well, you did get to meet Nick Hayes today.
I know Nick.
Oh,
and
yeah,
I know
yeah.
Jay
Yeah,
pretty well.
good,
but
good.
I just haven't been to the property.
Yeah, well, I live on that side of town, so
Okay.
I will be happy to drive you out there anytime.
We do great tours.
Well, Jamie, thank you
Thank you
again.
all very
Thank you
much.
so much for being on the show today. And thank you all for joining us. If today's episode sparked any questions about for Jamie, about the industry, about anything she's working on, please drop your notes in the show comments, and we'll get them over to Jamie and get them answered. Please also rate, review, and subscribe to our channel so that we can get this out to more people that need to hear it. Thanks again, and until next week, we'll see you on MasterMined.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.